Come on, hit it, yeah. The champ is on the mic. Struggles ongoing, but I know the battle is the Lord's. Though tears are overflowing, yet my faith remains. In hope I'm pressing onward. No matter what I face, I rise. His spirit leads me on all the way. Lord, I pray, help me say every day that I wake, I will praise you. Every breath that I take, Lord, I will praise you. My daily motion, I'm moving forward. My daily motion, I'm going higher. My daily motion, I'm moving forward. My daily motion, I'm going higher. Struggles are going, but I know the battle is the Lord's. Though tears are overflowing, yet my faith remains. In hope I'm pressing onward. No matter what I face, I rise. His spirit leads me on all the way. Lord, I pray, help me say every day I'm alive, I will praise you. Every way while I can, I will praise you. My daily motion, I'm moving forward. My daily motion, I'm going higher. My daily motion, I'm moving forward. My daily motion, I'm going higher. Are you ready?
Yeah.
Are you with me?
Yeah.
Are you ready? Are you with me? Are you ready?
Yeah.
Are you ready?
Yeah.
Are you ready?
Yeah.
Let's go. I owe my life to you. I rest upon your word.
That's right.
Your joy alone, my strength. I'm right on track. In you I have my peace, the rock that never fails. I pour my love on you. I know you're in control. I'm singing and dancing and praising, moving, 'cause my Lord is good. I'm rejoicing, progressing. I'm shouting, God is good. Hey, I'm standing under the rock. Hey, I know my God's in control. I heal, 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 I heal. I talk to the Lord, I walk with the Lord, I stand by the word of the Lamb of God. I talk to the Lord, I walk with the Lord, I stand by the word of the Lamb of God. This is my daily motion. It's guidance gives me higher. This is my daily motion. It's guidance gives me forward. This is my daily motion. It's guidance gives me higher. My daily motion. I'm moving forward. My daily motion. I'm going higher. My daily motion. I'm moving forward. My daily motion. I'm going higher. My daily motion. I'm moving forward. My daily motion. I am going higher. My daily motion. I'm moving forward. My daily motion. I'm going higher.
Hello, Daily Motion family! What's up? It's like people still remember that I'm alive. I'm feeling cool by myself. I'm feeling cool by myself, by myself, by myself, by myself, by myself. Hi, Daily Motion family. This is your girl. I am Dr. Olayemi Champion Odushola. Happy New Year. And it is a privilege and an awesome honor to be here today after being away for about 5 weeks, I think, for our usual Christmas break. And the fact that you remember that we come here is amazing. And that I sent out an announcement just one day before our cast. And you are here. In fact, that means clap for yourself. Clap for yourself, please. It's all right. Clap for yourself. I am so excited. I couldn't wait to come back because I am very well rested. I am very well rested and I have a lot of talking to do. But I can't talk because I have a guest. And my guest also likes to talk. So I can't do the talking by myself because I will be cheating my guest. I have to...
You.
But see, usually the guests will wait till we bring them on to start talking, but these guests cannot wait. So how about we just bring him on, so that we can say the shout outs together. Daily Motion fam, it has been an awesome time away. Actually, you know what? I don't know. What should I do? All right, I'm going to say hello first. Let me say hello. A proper hello. I missed you. I missed you and I missed me. In fact, me myself, I missed me from running my mouth. My mouth needs to be run. I'm going to say a few shout outs to the people who are on the cast. Hi, Doctor. Dr. Odeyemi is here. Hi, Dr. Femi. How are you? Hi, Pastor E. Pastor E is in the house. Auntie Nikki is here. Hi, bonjour. Bonjour. Comment ça va? Mr. Editor is in the house. Hi, Rusty. You're here. It is so nice to see you. You're welcome. In the beginning of the year, I usually take January off to spend time with God. My time with God was so beautiful. Over the course of the year, I'll gist you more and more about it. It's always so good. And I always encourage people to do the same. And as we were coming back, I was thinking, I'm going to be coming back in February. What time is it? It's going to be Valentine, you know. I said, Valentine, what can we talk about? Matters of the heart, no, or like a heart of the matter or something like that. Yeah? So I wanted to talk about heart of the matter and matters of the heart. So I wanted to talk about the heart. And I thought, how can we creatively talk about the heart? And we have a very creative way to talk about the heart tonight. We're going to talk about the heart, the one that beats gigging. You know, when you see somebody that you love. We're going to talk about the one that pumps blood around your heart with the help of our guest. Our guest that cannot wait to come into the studio. And then, since it's Valentine, we are going to talk about the heart, the one that does gigging. When you see somebody that you like. So we're going to talk about that. We're also going to talk, I told you to imagine what it means that size matters. Size matters. So people of God, don't let anybody deceive you. We're going to talk about that. We're going to talk about a lot of things. Hi, Ayo. Bamdi's in the house. Hi, Bamdi. Precious. Long time no see. How have you been? Mommy Shoaga is in the house. Hi, Mommy Shoaga. How are you? It's so nice to see you. I've missed everyone. Hi, Sandra Miller-Spraggins. It's nice to see you. Mommy Ronki is watching. Hi, how are you? It's nice to see you. Hi, Mommy Oyelami. Happy New Year 2023. Your DM fam. To God Almighty, hallelujah. This is our year of double portions and divine possibilities. In Jesus' mighty name, shalom.
Amen.
You missed us all. We also miss you. God bless us. Thank you so much for being here. All right. So I have to say something real quick before I bring our guest in. Our guest is a family person. But I was waiting on God. You know, last year I took a poll and I wanted to find out, you know, what was the best time for us to come together to do this. Because sometimes this conflicts with some of the things I want to do, you know. Sometimes I want to go to a party and sometimes this will conflict with it. But also, that's not the real truth. The truth is that sometimes people who live in places like London or Nigeria or Ireland, it's like 2 a.m. there. And I kept telling God, you know, I wanted to move it to an earlier time so that people who live not in our time zone could take advantage of it. And I kept talking to God and said, it's about the reach. So I've been praying about it, rich, rich, rich. And I told Monife, please help me pray. I'm praying for a better time. So thank God, yesterday God told me, who sent you rich? Just do what I asked you to do. If you want to move the time, move it to suit what you want to do. Leave rich for me. In fact, it's as if they slapped me. I was very happy about it. I don't feel rich, you know. It was rich. So good. So on the days that it conflicts with things that are very important to me, like next week, in 2 weeks, it does conflict with something that is quite important to me. I am going to try to cast at 2 p.m. if I have a guest who lives maybe in a West African time zone or something that I want to reach in the West African time zone. So I'm going to try to cast at 2 p.m. on the 25th of February, and we'll see what happens. If the family can join us, it'll be nice. If the family can't, it will always stay on the page. But we'll keep our 7 p.m. time, and I'll keep you posted. I've done enough talking. Our guest can't wait to come into the house. Let me bring him in, and then I will introduce him, and then he will introduce him. He has 2 introductions tonight, actually. The informal introduction and then the formal introduction. So since he has already introduced, he has shown himself. So after he show himself, let me show him. And then, please, I want you to welcome into the house. This is somebody that I met, and the very first day I met him, it felt like I had known him for years. DM fam, please welcome my brother, and I know your brother, Dr. GBOLAHAN OGUNBAYO is in the house.
Hey, you have to bring me in at your own risk, because you know as they go.
I know. In fact, DM fam, you are welcome. Hi, Mommy Ranky. How are you? Christiana! Hi, Christiana! Happy New Year! Happy New Year, DM fam. I did bring GBOLAHAN in
at your own risk.
In fact, the combination of both of us is a very bad combination. At everybody's own risk.
I remember the day we met too. I think they had to drag me out of there because it felt as if we were going to start causing trouble.
Our combination is not. It's a little volatile, but God will help us. We should pray tonight before we start. I think it will be very necessary for us to pray. Dr. Teju is in the house. Hi, Dr. Teju. DM fam, what's been going on? I have not been on social media since December 31st or January 1st. So I don't know what I've missed. I'm a little off. But what has happened is, I don't know what has happened. But if anything serious has happened, I hope you will catch me up. Hey, Mommy Terriba is in the house. Hi, Mommy Terriba. How are you? You are welcome. I'm going to be saying a lot of highs, and we're going to have a good conversation tonight. We have an important topic, but let me talk about GBOLAHAN. I love GBOLAHAN. GBOLAHAN is married to my sister, who I grew up with. And the fact that I grew up with her means that she's the one that knows my story. So because she knows my story, GBOLAHAN is somebody that I cannot front for. Because I know if I front for her, at home with Tony, she will reveal my secret. But there's no real reason to front for GBOLAHAN, because GBOLAHAN does not front for anyone. He just shows himself.
I front at work.
Hey, you are fronting at work? Take me there. Let me go and tell them your story. What is that nonsense you are going there to? Are you speaking English at the working place?
Babe. Queen's English. Forget about it.
Forget about it. You two will be talking. They will be doing like this for you,
They'll think I'm normal.
Let me not come to that your working place one day. Please help me greet at home with Tony. At home with Tony, I'm greeting you. Oh. Hello, baby. Oh, show one in the kitchen. Are you inside the kitchen area? Please, help me make my money. I'm on a diet.
Which kind of diet?
Seafood diet. When I see food, I eat it. Hi! Happy New Year, Auntie Boomy! Happy New Year to you. You're very welcome. DM fam, I have missed you. I'm telling you, I have missed you so much. And I'm glad we're here to catch up. I wanted us to have Dr. GBOLAHAN in the house today because he's not an ordinary doctor, not a ordinary doctor at all. And because I'm not educated enough to know what he does, he's going to use his own mouth to tell us what he does. Dr. GBOLAHAN OGUNBAYO, he's an interventional cardiologist. That means when they say in layman terms, like a layman like me, he's a heart doctor. So, Dr. GBOLAHAN,
Plumber.
he's a plumber. Like a plumber.
That's it.
He does like a roto-rooter of the of the arteries. Please introduce yourself to the Daily Motion family.
Hello, everyone. My name is GBOLAHAN OGUNBAYO, and there's not much to introduce with me because everybody knows me, so I can't even lie and try to form or anything like that. But I'm an interventional cardiologist, which means that what I do for a living is, other than trying to help people live a heart healthy life, when they have a heart attack or they're having chest pains, I try to find out why. And if it's due to a blockage in the arteries of their heart, we try to open it up. I also try to anti-teju at the genuflecto. Thank you very much. I also try to open up the arteries that go to the legs. In time past, I've worked with opening up arteries that go to the head as well. We also try to keep the heart healthy by preventing heart disease and preventing heart failure by helping the muscles of the heart stay alive one way or the other. I think that's the long and short of what I do.
Thank you. Thank you so much. But when we were looking at the singular view, let me show the singular view of your background. Okay. Even the gadget. Are you sure that your gadget?
Let me see. OAU, that's the one important one. Every other one is just a country.
Because everybody, please look at the back of Dr. OGUNBAYO's head. All the certificates that is in the back of his head. Some of them are from school, and some of them, there are some that are not from school. Can you tell us?
Well,
can you tell us? Can you tell us the ones that are not from school? Where are they from?
I can't tell you that one because there are people that are going to report me to pastor, but let me say the one I can say. So, in order to be, I guess, recognized or another degree, call it certification, in what you do, you have to take board exams. So, I'm board certified in internal medicine, in general cardiology, and also in interventional cardiology. So,
thank you.
Say we like all those kind of things.
And you say, but
I think cardio go the other side. Another 5 did the other side.
Well, look, Daily Motion family, don't mind him. If you will not tell them where the other certificates are coming from, me, I will tell them because he told me. He doesn't want to tell you. Yesterday, when I asked him where all the certificates come from, he told me that all his ex-girlfriend gave him certificates of completion before he finally landed with at home with Toyin. He said all his ex-girlfriend gave him certificate of completion.
That one said, "We don't give me certificates."
Even at home with Toyin gave you certificate of completion. He said because you finish her.
Because I finish her.
You finish her. You see? Clap! Please clap for yourself. Clap for yourself. Alright, dear fam, we are going to have fun. This is we come here, we have fun, we learn things, what's important. At the end of last year, there were a lot of course, heavy things that happened a lot of losses in our lives, in our community, just in the world in general. And as Christians, of course, everyone that makes it, we say, thank you, God, for preserving our lives. We say, oh, thank God that we made it into the year. And several things caused the death. Some were, socially related, some were emotionally related, some were about mental health. But a lot of them were just what I would call senseless. You just couldn't understand it. And so it felt like people were just dropping dead. And like I would explain it, it felt to me like God was looking down and saying, you come, you come, you. And it was kind of scary because it was like young people. It wasn't like older people in their 40s and people in their 50s. And if you don't have a clear understanding, you would just thank God that, oh, I thank God I'm still here. But, if you do have some sort of, medical inclination, when things are happening that way, you would understand that a lot of it has to do with cardiac health. When some things are inexplicable, and just what we call senseless deaths, we don't know what happened, it just happened, you have to look cardiac wise. So it was very heavy on my heart that this is something we needed to talk about. And as we were coming into the year with our first cast on Daily Motion on Valentine's Day, which is also heart related, I wanted to make it meaningful, and we'll tie it all together towards the end, how cardiac health has to do with your love life. So please don't leave this cast early, because the meat of it, gong, is at the end. So please, and get
The cocoa.
the cocoa of the matter, and please get the men in the house. And as women, we find our way to the doctors. We do, somehow, as young girls, or if we don't get there as young girls, we get there as young women, or we get there where we want to give birth to our children. The men, however, don't have a reason to go. A lot of the times when the men come into us as primary caregivers, if you ask them, why are you here? They will say, I don't know. My wife told me to come. That's usually what brings them in. So I just wanted to throw it to Dr. Ogunbayo in the house today, as males and females, what is the right time to establish care with a physician, with a health caregiver, with a primary health caregiver? Can you please shed some light on that?
So you know, I don't think that there's a right time to establish care, because you should never have not had care in the first place. Um, and for people that don't have care, to answer that question, when is the best time? The best time is now. Um, because as you know, for the females, they tend to have, at 18 or 21. I'm not sure what the guidelines are now these days. You have to do your pap smear, get the HPV, PVC, whatever you people call it these days. ACP, PDP. Yeah, you have to get uh, your human papilloma virus, shots, and so on and so forth. So that way the ladies can get there quickly, but the guys don't necessarily need to have any of that. And so they tend to feel like, and again, guys have this sense of macho. Why do I need a doctor? I'm in my 20s. I'm barely 20. I just want to live my life, and so on and so forth. But things that we'll talk about later is knowing your family history. For some people, some of the diseases that run in their families, they absolutely need to start seeing a physician even before they hit 20. They, in fact, don't need to have any break from seeing their physicians. And so, to answer the question very simply, the best time to start is now. But the right answer is you should have never stopped in the first place. You should at least see your primary care doctor, because, like they say, prevention is better than cure. So,
I love that.
you see
Thank you.
now, I'm short.
You see,
Don't tell me I'm not short. I
yeah,
prayed, and God told me, Shoki love yogi. That's it.
ọ̀rọ̀
Don't
àbọ̀rọ̀
talk. I
lásán
don't talk too much.
fọmọlúwàbí tó bá dénú ẹ̀ àdòdìdí double 7 7
Don't let me get
7
Kana. Don't let me get Kana here.
Don't get. Are you a born again?
Ah. I beg. Make I see the people where they inside before I know it's not going to talk.
Okay. There's a lot of people here. All of them are Christians. I mean Christians. Everybody that says is a Christian, except me.
And me.
And you. Yeah. Everybody is there is a child of God. Very good. Thank you so much for that. You just said it right. The only problem is a lot of us have missed the boat. A lot of us have missed that boat of knowing that we should have never been without care. And one big thing that you mentioned is that, a lot of us are under the impression that I am still young, so I really don't need to be seeing a physician. And the reason that is a misconception is because though we are young, we come from somewhere. And when I say we come from somewhere, I'm trying to talk about our family history. Can you kind of shed some... We come from somewhere. We come from some people. And by saying that, I'm trying to bring up the issue of our family history. Can you kind of shed some light on that? That no matter how old you are, it does not, it doesn't really matter, because there are certain predispositions you have just by being birthed into a certain family. Go ahead and talk about that.
So family history is important for many reasons. Number one, you can't change it. You can't change your biological parents, and so it becomes something that you absolutely have to pay attention to. And we were joking about this yesterday when we were talking about, back home when people get married, and I don't know, they probably don't do it anymore, but they will still say "Tani baba, tani ya, ibolosi wa," But then sometimes it's just a social aspect of it. But way back, they used to hire people. They call them alarinos, that would actually go into the family of the proposed spouse and try to figure out the types of illnesses that plagues that family. Most of the time, they think about mental illnesses and so on and so forth. But it's absolutely important that those people dig in and find out the other family histories that the family member has. I remember growing up, I had a family member as well that they were like, the grandfather, Oshoku, the father, Oshoku, the brother, Oshoku, and they were like, oh, we have to do this, we have to do this, we have to do that. And the truth about it is, it's absolutely possible that family and the person and the family members have a particular illness that takes them at a young age, most often than not related to the heart, cardiac arrest, and so I was talking about, and we're talking about generational curses, and in my mind that is something that back home they would say, oh, it's a curse or something like that. But with the benefit of science and knowledge, there's so many things that we call generational curses that is actually become generational ignorance. Because even the Bible says that my people perish for lack of knowledge or understanding. But by the time you understand your family history and you know that there is a particular disease that kills people before they get old, then you need to find out what that disease is and you need to do something about it. And the heart obviously is important, and that is why you need to know your family history, not just from the heart perspective, but also every other perspective that you have. Do you have a family history of hypertension? Do you have a family history of diabetes? Because those two are the biggies, and we're going to talk about them later. So you absolutely want to know your family history, because if you don't, you're already missing the boat. And I like to use this analogy for people. If this were a cup, and your cup has to overflow before you have a particular disease, your family history may have taken the cup up to here already. So you don't have much wiggle room, like someone that doesn't have that family history, to be able to do something about it. And so Um, long and short, your family history is absolutely important. At the age of 18, you should be able to have spoken to a family member, father, mother, or someone that is alive, and ask them, what are my risks of, heart disease, even mental illnesses, whatever it is, what diseases run in my family, because I need to make changes, I need to make adjustments so that I don't fall victim to any disease that runs in my family.
Thank you. Thank you so much. You are very good. Oh, you are. This English is the same one that you are speaking in your school.
But no, that one is even this one.
It's even different from this one you
This
are
one is
speaking.
Nigerian English. This one is Nigerian English. The one I speak over there, uh, forget. I'm in the south too. What's the name? That
Eh,
man saw that man law and check his. Make
get
I not
out,
talk am.
get out,
Make I
get
not talk
out.
am.
DM
Forget.
fam, how are you
Silent
guys doing?
before.
DM fam, how are you guys preparing for this Valentine? Valentine is coming. Valentine is coming. Valentine is coming. No more married beds. No more. How are you preparing? Me, I'm preparing you. I'm preparing with all these things, and I have some. We have some tips. Tips is a double in the end innuendo.
On Valentine's Day, me I'm going to have diarrhea, so I'm not going to be doing anything.
You can't have that. It doesn't matter. Buy everything you need to buy before that time.
I'm having diarrhea now. From now to Valentine's, I have diarrhea. Nothing,
Today is
nothing.
already the what's today's day? The 11th.
I don't even know, but I'm already having diarrhea.
It's like that started. You're already feeling it.
No, I started 3 weeks ago.
Oh my. DM fam, if you have any questions for Dr. Ogumbayo, could you kindly go ahead and put them in the chat. We are combining cardiovascular health with actually our love life. That's what we're trying to do today, and it all is connected. And we're slowly edging there, and I think it's gonna be fun. So let's say, like I said, I'm Nigerian, even though it's not evident, because this here now, one would think that I'm from Malaysia with this my hair. It's my Malaysian hair.
You are from
And
India.
is it India? India people, their hair is curly like this.
It depends.
It depends. I was looking more towards the Malaysian area that I want to go. And so I was saying, say I have looked into my family history, and my mother is healthy. She has no history of maybe high blood pressure or diabetes. She didn't have a heart attack. She didn't have a stroke. What are the kind of illnesses? And I think you may have already mentioned that as I just naturally age, I am more predisposed to having, just because I'm getting older and I'm alive. Can you kind of shed some light on that?
Well, the way I like to describe it is, as human beings, it's like a car. No matter how well a car has been taken care of, there are certain things that will start to go wrong as the car gets older and as we start to use it, wear and tear, and so on and so forth. Um, and just as a general rule, most diseases would increase in incidence and prevalence, meaning there's a higher chance that you have most diseases as you get older. There's a higher chance you have heart failure. There's a higher chance that you have a heart attack. There's a higher chance that you have a stroke. There's a higher chance that you have atrial fibrillation, which is an irregular rhythm of the heart. There's a higher chance that you have COPD, whether you have smoked or you haven't smoked. Um, there's a higher chance that you have blockages in the arteries of the legs, depending on how you have lived. There's a higher chance that you develop diabetes as well. There's a higher chance that you develop high blood pressure. And all those things, again, unfortunately, one thing will lead to another, and some of these things will increase your risk of developing other illnesses. And so they can talk about arthritis and other non-cardiac or non-cardiovascular illnesses as well. But if you want to focus on my field, um, you know, heart attacks can be prevented, and as much as you get older, your risk increases like I said, all those risks are cumulative because it's not everybody that is old that will have a heart attack. And so those other predisposing factors, both the ones you can and cannot change or switch around or prevent, increase that risk to the point where your age is now just one of those other things and not necessarily the reason why you have that disease.
Thank you so much. So let's just stay right there because I think you're right where we should be. There are some risk factors that we can change, and there are some that we can't change. For example, this age business. Is there medicine has not moved to the part to where we can change it?
Botox will change it.
Botox to use to change it will reverse it back or you reverse it forward.
And BBN.
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 Which one is that?
L for elephants.
So I think we get into the issue of there are risk factors that can be modified and risk factors that cannot be modified.
Yep.
So can we kind of shed some light into that? So go ahead.
Age, like you said, you can't change, and you can't change your XX or your XY. I'm
don't specify to be SS or SY. Even those that went to Orile Grammar School, we don't know SS or SY.
See. Don't let them fire me. I cannot say some things.
There are some things.
XL and XY. You are a child. Me, I'm just a rookie. I'm just starting.
Okay. We are okay. What you hear me? WQSYZ.
So you can change the phenotype, but you can't change the genotype.
Jesus. Definitely much of family. Do you people know what he's talking about? I don't know what he's talking about.
It means you can change the outside, but you can't change the inside.
Okay. I'm understanding. I'm understanding.
I'm
understanding. I think what Dr. Ogunbayo is saying is that there are in the transgender community, you can change your gender, but the chromosomes cannot be changed. So the X and the Y chromosomes is what makes a male and a female genotypically, right? So he's saying even if in the transgender community, because we take care of transgender patients, so that there are certain things that can be changed and there are certain things that cannot be changed. Age and the X and the Y chromosomes are one of those things that cannot be changed. All right, we are flowing along with you now.
Yes, now your family history we mentioned you cannot change, and again, I'm going to bring my carb again when you're talking about the problem. So family history gets here, age gets you here, your gender gets you here. So already, even if you live, even if you live the healthiest of lives, there are certain things that you cannot change that would invariably, at some point, start to increase your risk of certain diseases. The other things that you can change, they're called modifiable things, and the first thing that I like to mention is stress, and that is because stress by itself is one of the reasons why, like you were explaining, a lot of people are losing their lives. We live in a very stressful world, and coupled with the societal expectations and so on and so forth, the stress doubles, triples, quadruples at times. The next thing I like to talk about that you can change is lifestyle. What do you put inside of you? What do you eat? And what do you take outside of you? How do you exercise? Or do you even exercise? A lot of times, we try to talk about that. Other things that you can change, and you can even classify that as things you can't change, but where you can change them, is your response to illnesses. How are you treating your high blood pressure? How are you treating your diabetes? And so on and so forth. So lifestyle generally is some of those things you can change. Do you smoke? Do you drink? Do you practice healthy and safe, not just heart-related things, but also even sexual behavior? And we're going to talk a little bit about that later on down the line. All those things play a part in increasing or decreasing your risk of having cardiovascular disease. I was saying yesterday that exercising alone by itself can actually increase your levels of HDL, which is the good cholesterol. And so, some of the things that we can consider start doing or stop doing um, to increase or decrease our risk of heart disease. Yeah, yellow.
I'm here. We are here. We are hearing you.
Yeah, that's all I need to say. You just eat well, exercise, perfect.
My brother,
That's it.
will I not borrow you this by glass like this? Because I see that as you are trying to read that thing that Christina wrote, you are doing like this.
I have to do like because they say that once you are doing like this, that you are more hands-on.
Ah, is that right?
You won't think you.
Is that how you are catching at home with Toyin?
Uh, she's catching herself.
Good job, Jare. At home with Toyin. You are catching. I was a witness to the catching. In fact, I can write a book about that catching, but we are on live wire. I will not write that book
Somebody
now.
was just walking in Amala joint. You will not let somebody walk in Amala joint just by himself. You'll be doing kiniko. That's why I enter all this trouble now.
Is the Amala?
They lead me to be walking in my bolat. JJ.
Was it Bolat you are walking?
Yes, now I was walking in bolat.
That's where she catch you.
No, she just walking and wanted to eat Amala. I was even doing kiniko. She just say it's by force. You have to call me. So what do I do now? I have to respect myself.
You did. You are, and God was with you. I can tell because look what the Lord has now done. So you shall Let's circle. Thank you so much for that. So I hope we are following DM fam. I know we are using, she said lies, lies, all manner of lies. I hope we're following. As a primary caregiver, I wanted us to, so we've talked about, the risk factors that can be modified and some that cannot be modified, things we can change and things we cannot change. Some of us already have this condition. So some people already have high blood pressure. Some people already have maybe high blood sugar. Something that I hear in my office maybe like 10 times a day that I can never get over is, people walk in and they would say, I didn't use my blood pressure medicine today because I just wanted to see how my blood pressure is without it. And sometimes I think about taking Pankere to work to be flogging the people who say that. Koboko, no, you use your medicine so that I know if it is working for you. Don't come here to say that, and there are certain things, that there are certain things that people need to understand about holding their medicines and not using it all the time. Because sometimes people would have medicines for high blood pressure, or they will have medicines for high blood sugar or other things, and they don't use it all the time because they say, oh, it was doing fine, so I held it, so I'm not using it all the time. So certain illnesses that puts us at a greater risk for having heart disease, what we call cardiovascular disease, which is like heart disease or a stroke. Can you kind of talk about some major ones that puts us at a higher risk? I think high blood pressure we call the silent killer. Can you kind of talk a little bit about that?
So, some of the things that people do is they'll say, I have diabetes, but I'll eat this food and now go and take more insulin. Add that one to it. But now, hypertension and diabetes are huge. But let's talk about hypertension as the silent killer. When I look at you, if you have flu or you have something like that, I can tell you, you don't look good. What's wrong? You are coughing, you have runny nose, and so on and so forth. You have a fever. I can tell you, maybe you need to go and see a doctor. Go get checked. But except if they've just developed it yesterday, there is no way you can look at somebody and say you have high blood pressure. And so they call it a silent killer because most people don't even know. They walk around. I mean, I had a patient about 2 weeks ago that walked into the emergency department, was fine, came for something entirely different. The blood pressure was 253 systolic. Now, some people don't know what that means, but if you divide that number into half, that's when it's going to be at least a little bit normal. A little bit normal. 253 systolic was what the guy, and he was fine. He was like, "Are you okay?" People were worried. Like, yeah, I'm fine. When can I go home? That's why it's a silent killer, because as that blood pressure is that high, it's destroying every single part of that person's body. You can imagine taking the pressure of a big pipe like this and putting it in a small pipe like this. It's going to start destroying it. And that is what happens with high blood pressure that is not well controlled. Over time, those small arteries of the body gets destroyed, such that some people do a CT. They've never had a stroke, but they will do the start and say there's changes consistent with high blood pressure, because some of those, we call it end organs, some of those small arteries have been destroyed. And so you will start having even mini strokes that are not clinically relevant, but you're destroying your brain cells. It's going to destroy the kidney. A lot of times people come in and their kidney is already at half mast, even without Lysol, it destroys the heart as well. Every single organ in the body gets destroyed. And by the time these patients come in, they might come in, say, for example, for a stroke or a heart attack. You start saying, the kidney is not good anymore. The heart, you get as a bill. This one is wrong, that one is wrong, including the eyes, including the Oshamo. The something self can be destroyed.
The what?
The Bene Buffoli.
Who?
The something. The sababi that caused the whole trouble. You know what I'm talking about?
The Sababi?
Area 1.
Area 1, okay. I know Area 1.
and hopefully we'll get time to talk about ED and Area 1 as well. Because it's a very important part of relationships, and we're talking about relationships today. So that's why they call it the silent killer, because it works in those trenches to destroy things in the body, even before we know we have it.
Thank you so much. And we mentioned about diabetes, and you were saying, people think they can just take more insulin to just eat whatever they want with diabetic control. And I always have this thing that I tell my patients whenever they get, I hate when my patient gets the diagnosis of diabetes. And I always scare them when they get that diagnosis. I tell them, when they get that diagnosis, I said, pretend I just told you have cancer. Because somehow people don't take diabetes serious as cancer. Like if you told somebody they had cancer, they are very scared. They don't, they're like, my family, they're thinking about the end of their lives. But they don't seem to understand that diabetes carries almost as heavy as that. Diabetes basically increases your risk for every disease that you possibly can know in this world. It's that serious. And like Dr. Ogumbayo was saying, you can't just take more medicine to eat whatever you want. And the reason is because it greatly increases your risk to either suffer a heart attack or a stroke. And another big thing is that no matter how good you are with diabetic control, it's going to get worse, because your body naturally ages. And as your body naturally ages, the medicine that worked for you when you were 45 is not going to work as well for you when you're 50, because your body is naturally aging, and it's going to become less sensitive to the same medicine. So you're going to need more and more. You're going to need more exercise and more exercise. You're going to need less food and less food. And from in any culture that you find, we especially at, like I said, I'm Nigerian. He's from Kutonu Abibulele Tiwa ni just no
Lome.
lẹ́yìn Tiwa. I'm from
Lome.
my mommy is Kutonu, my dad is Nigerian. So so a lot of our foods are they're so carb loaded, they're so starchy, and it's not just us, it's a lot of the cultures, even the American and the Western culture, that you can't run away from starch and carbs. I remember one of my patients that had gotten a diagnosis of diabetes, and I because I love nutrition, and so I spend a lot of time educating about what they can eat, how I breaking it down, carb counting, how much of this you can have, and then I send them to a dietitian. And this patient came back to me and she said, "Doc, after I was done with you and the dietitian, this is how I feel. I feel like you both told me buy the food, like there's a food in a container. I felt as though you both told me buy the food, pull it out of the container, throw the food away, and just eat the box.
Yes, okay.
Because it looks like I can't eat anything." And that's really how diabetes is, because everything is like there's carbs in everything that you do. So the best thing you want to do is not get it. Don't get the disease. So try your best. Don't rely on the medicines. Another reason you don't want to rely on the medicines is because there's side effects to the medicines that you take. Those medicines, there's also things they do. Yes, they do help you, but they also have their own side effects. And so thank you so much for helping us with that. In the promo, of course, because you know me now, I said that size #size matters. And size matters. Size matters. So people don't let anybody deceive you to use the bread to call yellow meal beje. Ben yo, I pick the one. I pick this one.
Pick your choose.
Pick your choice. So size matters. So anyway, and in the promo we were talking about size matters, and in this case we want to talk a little bit about exercise and obesity. And when we're talking about exercise and weight loss to control your risk factors for developing health problems, I want to tell you something that's very important, and I want us to pay attention to this. We're telling you to exercise so that you can get healthier. We're not telling you to exercise to get skinny. If God wanted us all to look skinny, He would have made us all the same size, because God knows what He's doing. He's not, you look at the beauty of the earth and just look at how He so finely crafted everything. He knows what He's doing. So we were not all made to look the same way. And in the world of Instagram and all of this, they present what beauty is supposed to look like to us, and nobody should be fooled by that. So as we talk to you about exercise and allowing your body to work the best way it can for you, it is not so that you look skinny. It is so that you're healthy. Can you kind of just talk to us a little bit about exercising and controlling our body mass and body composition? Thanks, Doc.
So that's a loaded question, and I guess we'll have to probably discuss it rather than try to just pontificate or something like that. But when we write notes and we see an obese patient, most often than not, the way we say it is obesity complicates all aspects of care. And just to make it simple, that is a very true statement. Now, and that's because if I get someone that is normal weight or a little bit overweight, and I get someone that is significantly obese, they have the same everything, same comorbidities, meaning same illnesses. If both of them have a particular illness, it's more likely that the person that is morbidly obese is going to have a worse outcome. But that said, the size is more than what meets the eye. I was sharing yesterday that I have some patients that are, easily a size and a half or even double my size, but their cholesterol numbers are better than mine. Yes, Dr. Adeyemi, diabetes is and I was going to say this before I got carried away, sister, that diabetes is a coronary artery disease equivalent. What that means is when you have diabetes, immediately we take it as if you already have heart disease and that your blood vessels are not good. Uh, and I was saying this as well, that if you give me cigarettes and you give me diabetes, I will probably prescribe cigarettes before I prescribe diabetes. And that's how bad it is. Um, I've seen patients in their 30s, their 40s that come in and need bypass surgery. They never smoked, but their mothers and their aunties are the one bringing them for their appointment. That is how bad diabetes is, especially when it's not controlled. But to get back to the obesity question, um, what you see is not necessarily what you get, and I mean that in every way. Just FYI, but but because someone is of weight does not necessarily mean that everything going on the inside is not good. Now, that said, we encourage exercise because, um, you know, with the weight, imagine the way I try to describe it is when God made your frame, He made that frame and that height to carry a certain size. And so the moment your size is more than what your weight can carry, it starts to weigh you down. No pun intended. You start having diseases like arthritis and so on and so forth. Um, but to come back to the exercise, what that helps do, other than the other things, is number one, your HDL goes up. Number two, you can drop some weight and you can get your weight into a reasonable weight. But like you said, your goal should not be I want to be skinny. Your goal should be I want to be healthy. I want to be around for my children. I want to be around for my children's children. I want to be able to live my life and enjoy life as is, rather than worrying about certain diseases that can plague me if I continue to be who I can be if I don't check those things and go to the gym. Um, I think I should stop there because I want to go into a
to a
deeper
more
life.
important topic, we are going to go into that topic now. But there's a question here. Hi, Mommy Are. Hi, how are you? She said, "Do doctors realize one gets tired of swallowing daily pills?" Yes, we do, all their lives. Once doctors put one on medications, it becomes a life sentence. When do you wean us off? Do you wanna answer that, doctor?
Well, I always tell my patients that you are your own best doctor, because when you come, the only thing you don't have is you don't have the degree that will make you do certain things. But your actions and your inactions at home can invariably make it such that you can be on fewer meds if you do the right things. And what do I mean by that? I have some patients that have gone for weight loss surgery. They start fainting at home because now their blood pressure is so low because they've lost all this weight that we have to start taking them off of medications. I've had patients that have lost weight and we've taken them off of insulin, we've taken them off of metformin. They're now almost like, at least for all intents and purposes, medication free. Now, there's some medications that you cannot afford to not take. For example, if you have a stent, there you have to take blood thinners. If you have AFib, depending on some scores that we calculate, you have to take certain medications to help thin your blood. But
AFib is irregular heartbeat.
Irregular heartbeat, yeah. So I would say continuously have conversations and communications with your physician to see which medications are not necessary for you to take, and or ask him, what actions can I take in order to say wean myself off of some of these medications if they are possible. But that conversation needs to happen. Please, please, please do not wean yourself or stop medications without the consent of your primary care doctor or your specialist doctor, whichever one prescribed the medications.
Thank you so much. And that's very important. That's actually very important to, whenever I get a new patient, My first time patient notes, they're like a novel, because in fact everything is inside there. How many cards they have,
Passport
how
of
many,
Malamilia.
in fact how many underwear they have, what the color of the underwear is. There's nothing that is not inside that note. And I make sure that they go over their medications and they tell me what they're using it for. And if they don't know it, that is the day they know it. And when they come back the second time, I quiz them. Because I find out that a lot of patients don't know why they are taking what medicines. And you are your own best advocate. You should not be taking any medication that you don't know the reason why you're taking it. There are certain medicines that are used for multiple purposes. Sometimes some people are on a water pill. And like maybe say you're on a medicine called hydrochlorothiazide. Occasionally we use that for high blood pressure. Occasionally we use it because your legs are just swelling. Some patients are on there and they're just using it because they have something like, maybe we call it venous insufficiency because your legs swell or something. But on their chart is hypertension, hypertension, hypertension. So like they come and they're saying they have hypertension. And one day you mention hypertension, they're like, hypertension, I don't have hypertension. Where do I have hypertension? But there's hypertension in their chart. All over like for like 20 years they've been writing hypertension in their chart. I said, you're taking this medicine, do you know why you're taking it? He said, no, the doctor, one time my leg was swelling, the doctor just gave me the medicine because so all the patients that I get, I go over that. I say, you're going to tell me why you're taking this medicine. Do you remember when you started taking it? And by you knowing when you started taking this medicines and why, and you're going to forget, so you're going to need to write it down. You keep your own record. I'm not going to lie to you. The record that we keep is wrong. I'm going to tell you the truth. Sometimes it's wrong. Sometimes there are things in your chart that are not correct. So make sure you have your own chart. And it's great now that we have EHR, though some people make it a duty to kind of go over their chart and they're asking you, why is there a dot on my eye? And it is just ridiculous. But you should know the medicines you're taking. You should know why you're taking it. That way you're informed. And then you can ask the questions that Dr. Ogumbayo is telling us, what can I do to get off this medicines?
Additionally,
go ahead.
Additionally, whenever you go to your doctor, even if you've been going for 20 years, get your own, I call it a mini pharmacy, because some of my patients, put it in a box, put it in a bag, and take it to every single appointment that you have. Because you might be seeing 4 doctors, and one may have changed your medication, and of course, we don't do a good job of communication. So if that happens, you would not be able to correct that change in this new doctor's office. Mm-hmm. Secondly, if you have high blood pressure, other than your medications, your next best friend should be a blood pressure cuff. So you're not going to be obsessive about it, but at least check it, once every 2 weeks, once a week, something like that, depending on how well controlled your blood pressure is. And when you're going to all your doctors, take your blood pressure cuff so that you can compare it to theirs, so that you're sure that yours is okay. Mm-hmm. And then your log, where you've been writing all your blood pressures, taken the right way, hopefully you know how to take it. You take that as well. And the reason why is so many things can change in the 6 months that you have not been seeing your doctor, or in the 4 months, or in the 3 months. And you want their records to be the same across board, so that one person doesn't have 5 milligrams of lisinopril and the other one has 40 milligrams. Then the confusion comes.
Exactly. I'm going to say hello to hi Adogo. Adogo is in Nigeria. You're in Nigeria where they are buying money with money. Oh yes, no. She said hello from the land of no money and confusion. You will not be confused in Jesus' name. The Lord will intervene. We speak into the land of Nigeria. Father, have mercy. Overturn the power from the hands of the powerless, oh God. Arise on behalf of your people, oh God. Come and take your place, Heavenly Father, in Jesus' name. Amen. Good morning. Thank you so much for hanging out with us this early in the morning. Thank you so much. Thank you. Hi, Aderoke Lawal Ayeni. You are all the way in London and also staying awake. Thank you so much. She had a question for you, Dr. Ogumbayo. She said, I'm not obese. I don't have any medical problems, but I don't exercise. And she wanted your input. Is this good? Is this bad? Should she be exercising? I'm trying to look for that question. I'm not obese, but I don't exercise. What are the risks?
So, exercise decreases your risk of cardiovascular disease, period. Whether you're obese, whether you're not obese, whether you eat right, whether you don't eat right, exercise alone decreases your risk of cardiovascular disease. And again, it's one of those things where you cannot be testing yourself for everything every day. And so it's almost like they say, pray so that you don't have to pray. So I like to say, exercise so you don't have to exercise. Exercise, like I said earlier, increases your HDL, which is the good cholesterol, which invariably also reduces your risk of cardiovascular disease. So please exercise. And a lot of times people get this, and I'm sure you get it in your practice too. Oh, my work is exceptional. I go up, I go down, I shake it. Everything you do at work is not considered exercise. No matter how hectic or labor intensive your job is, that is not exercise. Now, if you decide to take a walk on your break time, now that is considered some form of exercise, and that counts. But exercise is time taken out to specifically work on, walking, going to the gym, and so on and so forth. So please exercise though, so you don't have to exercise.
And I think that it's actually important to talk a little bit about Dr. Ogumbayo is talking to us about HDL. HDL, sometimes they tell you your cholesterol is good, your cholesterol is bad. Your bad cholesterol is bad, your good cholesterol is good. It's also confusing. We're like, what the heck are you guys talking about? And the HDL is the good cholesterol, and somehow Dr. Ogumbayo, can you kind of help us? The good cholesterol, it's almost like a vacuum cleaner for your arteries, is what I try to explain to the patients. So can you please tell them, because exercise will increase your good cholesterol, and your good cholesterol kind of helps you to remove the bad cholesterol. Your bad cholesterol is a sticky cholesterol that clogs up your arteries. So just by exercising alone, even though maybe you come from you have a good family history, no health risk for cardiovascular disease, you don't have hypertension, you're not obese, maybe you eat well, you're even just increasing your risk, your good health by you're vacuuming your arteries just by exercising. So reducing plaque buildup inside your arteries just by exercising. So you're just doing yourself some good benefits there. Miss Lawal Ayen, it's so nice to see you. Look how beautiful you are. You are still beautiful. You are still beautiful like this. What are you doing that the rest of us are not doing? This is how you have looked for the past 40 years. What is going on? Okay, I will hit you up later. Jesus. It's Jesus. She's using Sag, by the way, it's a lie. This is not Jesus. All of us are following. These people are dogmacy.
See, some people have Jesus more than some other people.
You are right. Because me, sometimes I buy slide, sometimes I front slide. Ayo says, thank you for all the great medical information, Dr. Ogumbayo. Leke says, great to see my favorite doc.
Babani, eh?
And Mommy Are says, you're a thorough doctor. You give an excellent response. Thank you. I'm impressed with your detailed explanation. Hey, Dr. Gunwa is on the line. Hi, Dr. Gunwa. How are you? Very well. Thank you. I wanted to tell you something about your blood pressure. And then we're going to move for the next 21 minutes to very, very important things about Valentine's Day, because I want you to have a very nice Valentine's Day. And about the area 2 and the Sababi, they were questioning you about that area 2 and Sababi something. You better be prepared.
I did not say area 2, it's 1.
Area 1, some people were calling it area 2. They said they didn't understand what you're talking about. Well, we will get to it. We will get to it. Area 1, eh? Everybody get your significant others, so please get them, wake them up if they are asleep. Literally wake them up. Wake them up and then wake them up. Anyway, I'm coming. I know I'm not coming. I'm sorry. I'm saying
I'm coming.
Okay. So with your blood pressure, with your blood pressure, please take your medicine when you go to the doctor's office. The reason is because when your blood pressure is high when you come to the doctor's office, we will naturally say we will increase your blood pressure medicine. because your blood pressure is high when you come to us. And you don't need that increase. So we're giving you more medicine when you don't need more medicine. Also, there's this thing that we call, clinical, hypertension, which means in the clinical setting, you're coming to see your doctor. In your head, you are thinking, what will these crazy people say is wrong with me again? So you're already a little anxious. They call it white coat, syndrome, meaning your blood pressure naturally rises in the clinical setting. There's a little bit of that. You're a little anxious. Maybe you're rushing. You don't want to go. First of all, you don't want to go. Second, you're rushing because you're running late because there's so many things going on in life. So naturally, your blood pressure is higher. It's important that you have your own log, your own meter. Because the one you take at home sometimes is more reliable than the one we take in the office. So I always tell my patients, have your own meter. Write it down if you have to write it down. And if you don't write it down, bring your meter with you when you come to me. Because even if your blood pressure is high when you're in my office, I look at your log. And if I can tell that your meter is working the same as my own meter and your blood pressure at home is fine, I can naturally tell you are just anxious because you are with me. Yep. And you are wondering whether my head is 2. And I tell you there, I say, as you can see now, my head is not 2. So now you know I'm okay. So don't be afraid.
You can even tell them a secret that sometimes even my head is not really my own.
It's Mr. Head, somebody else's head.
It's for Ada.
It's for Ada. Or it's an India head like Emma Malin or something.
Yeah.
Mm-hmm. Yeah. So it's very reliable, the one you take at home. When you take your blood pressure at home, don't wake up from bed, bara. When you wake up from bed, you are sleeping, you just wake up. I want mama to school. By the time you wake up, you're already in a panic because you're thinking, I need to do this, I need to do that, Don't take your blood pressure then. Try to relax, ease into your day. Even say a word of prayer or something. God, please, I commit my ways into your hand. Rest for about maybe 10 minutes or so if you can. Relax. Take some deep breaths. About 10 or 15 minutes after you've settled down, take your blood pressure. Make sure that your feet are planted on the floor. Don't be stressed. Don't keep your arm up and then be taking your blood pressure. Even naturally holding your own arm up with your own strength raises your blood pressure by a few millimeters of mercury. So make sure you're resting it on something, even at the level of your heart, like a table or something, and don't be talking. Don't be there say, Mama and the blood pressure machine is going and you are doing.
Why don't you move motor from here? Oh yeah, again take blood pressure. You don't kill about one.
That's the time that you are telling your Shebi must go for boy. Have you taken the garbage outside? Every time I tell you to take the garbage outside, you are not taking the garbage. So please, when you take your blood pressure, make sure you're relaxed, make sure you're not talking, make sure your feet are planted, and don't take your blood pressure over clothing. Make sure it's on your bare skin. Don't take it over clothing because that also elevates your blood pressure a little bit. Okay, so and then take your log to your physician. Now, it's thank you so much. Let me see if there's anything else. Can our feet be on the bed while taking the blood pressure? Yes, your feet can be on the bed. Can we sit up on the bed to take the blood pressure? Yes, your feet. Bisola is asking all these questions. Yes. Yes to both of those questions. All right. So I wanted us to come back. We were coming back, like I said, to this kind of Valentine. Some of us now, we're going to celebrate Valentine's Day this weekend and next weekend. I like when Valentine's Day fall in the middle of the week because that means 2 weekends we are going to celebrate. That's what
I like when Valentine fall in the middle of the week because I'm on call.
Toyin Magba.
Forget it.
Toyin Magba
forget about it.
We're going to celebrate it this weekend, then we're going to celebrate it next weekend again. 2 weekends in a row. Bow.
Pre and post.
Pre and post, yes. At home, you say you are feeding us with all sorts of delicacies, and you are teaching us how to watch what we eat. How do you balance it? Wisdom. You use wisdom to balance it. That's how you balance it.
I tell people that if you are ready to put it in, you must be ready to take it out.
That's right.
Now you don't, and good food is good, and I've never told my patients you should never eat good food, but you know, again, size matters, right? Are you eating five of the shokomilo, or you are eating one? You know, are you grilling your food or are you frying it? So those little and subtle changes can go a long way in at least preserving what you will consider, oh, this is a food that I don't want to give up, but can you modify it? Can you eat a third of what you usually eat rather than going all out? Is your eba? Is it the larger than life size, or is it the kompolo, something that you can just, okay, this is not jeba, kinje kekere? All that kind of stuff really matters. So
It does. It
I
does.
don't think can give you food, but tell her to reduce the portion.
To reduce the portion, that she should not. I don't return. Don't kill Dr. Ogunbayo Olowo Ori. They say thank you, Dr. Ogunbayo Olowo Ori at home with Toyin. She can't come and kill you. Hi, Auntie Irene. How are you? I don't know if I haven't said hello to anybody here, but everybody that has joined while we are running our mouth, hello, everyone. I have missed you. All right. So we were coming back Valentine's Day weekend, and you know it breaks my heart because when you look around us, you and I know one or two or three or more families where the way I say it in my language is, I don't know how to say it in English, and this is a plea. This is indeed a plea, even as we go into, serious conversation still. Where two people's load have become one person's load. Yeah, seriously. Where there's only one parent in the home now. Because there has been a death, because we've lost one parent. Sometimes the men don't go to the physicians. The women are forcing them to go to the physician. But sometimes even us ladies, we make everybody go, but then we don't go. Please, we're begging you. Let's go. Let's take care of ourselves. It's okay to over-spiritualize everything. Like Doc was saying. We can say that, the father died of this, the grandfather died of this, the uncle died of this. And so you can say, oh, it's a curse, or you can go get bere because of that, or you can go and wash the head because of that, or use all the anointing oil in the world for that. But we can also take care of ourselves. So this is just our plea, for our children. They do what they see us do. So let's leave a legacy where they know that, preventive healthcare is the best healthcare. Like we said, the medicines we take, like the high blood pressure medications, you can develop high blood pressure, ogunwa. But the problem is that the ogun self, it will not let the area 1, it will not let it work again. Some of the men that come into the office, they're not using their blood pressure medications because it causes erectile dysfunction, and this is what is taking us into the Valentine's place. And I also want to plead with our men. If you're a man or if you're a woman on the forum when you have a significant other, so I was gisting people, and I was telling them that people sometimes they will come into my office and say, hey doctor, I want to discuss something with you. It's quite embarrassing. And I say, my dear, even I tell Precious on a daily basis, sorry if it is bad for Christians, that because I'm a bad person. You people know it's only God. God is only using mercy to deal with me. I see pennies that is not my husband pennies, at least 5 a day I see. So you want to discuss something that will embarrass me? I'm embarrassed at least 5 times a day because other people's property is in my hand all the time. I said the only one I have not seen is one that has 2 heads. But so when they are coming, I want to say something to you. It's quite embarrassing. I said, there's nothing you can say to me that will embarrass me. This is my job. This is what we do. whether you have a male physician or you have a female physician, there's nothing you're going to say that is going to embarrass them. And you have to understand the importance of, a healthy sexual life in your marriage. A lot of men are afraid to tell their physicians what the problem is because it's an ego thing for men. A lot of who you are is defined by how, sexually active you are, or your sexual I don't know how to put it, Sha, but you understand what I'm saying. Prowess, right?
Yes. Sexual
Energy. Prowess. Okay. So please, it's part of life. Naturally, as you age, it will change. There are certain things that are going to be different. There is a certain change that happens when people are younger. For a younger male, they have a more visual stimulation, where when you see a young guy, and it's in a different part of their body, it stimulates nerves in a different part of their body, where a younger male will see something that will stimulate something, somewhere in their spine. It's somewhere between, their thoracic and their lumbar spine, around T11 to L2 or something, and they will have an erection. When men get a little older, that doesn't happen as much. They move more to something we call a tactile stimulation, which means you have to touch it. So when men get to something like their 40s or their 50s, that whole natural just see it and they will have an erection, it doesn't work like that so much anymore.
Auntie, sorry.
Yes.
That means I'm 18.
You are 18. That's wonderful. Toyin, well, congratulations. But thank God for you. Yeah, so that means that then they need more tactile stimulation, which means that it now moves to it's in the sacral portion of their spine. It's somewhere between S2 and S4. So when that starts to happen, you'll find out that maybe your significant other needs a little bit more help from you with stimulation for them to have an erection. All of this is not a problem. All of this is medical. As they progress in age, they may start to have erectile dysfunction, which means they may not have a natural erection anymore. If that is a problem, don't wait for it to become too much of a problem. And these are some of the reasons why we tell you to not develop high blood pressure, to not smoke, to not develop diabetes, because all of these things play a role. Doctor, I want you to, I just want to lay the foundation. I want you to tell us how all of this play into cardiovascular health. Because when we're talking about cardiovascular health, they think it's just having a heart attack or a stroke. So basically, when men have an erection, there's a mechanism that it follows. Blood rushes to certain areas of the penis, right? There's something that exists in the penis that has to do with it's called the nitric oxide synthesis, right? If you have diabetes, if you smoke, or if you have like testosterone problems, you already have problems with this nitric oxide component there, so that you already have a diminished problem with making the nitric oxide that is needed to make you have an erection. Now, if you are having diminished blood flow that is coming from above, right? That means you are carrying less oxygen to come and combine with this synthesis, right? To make you have the compound that will stimulate an erection. So we're not just telling you don't smoke because we don't want you to smoke. But we're not you understand? All of it is working together for good. So
yes,
as you are thinking about your health, if you're a younger person that comes across this post, it's all of this is cool. You're smoking, it's okay. All of it. And I know that for men, if you won't even go to the doctor because of high blood pressure, because you have a headache, because you think it will pass, I know you always want to preserve your erection. So as you take care of your health, know that it all plays into that. So Dr. Ogumbayo, please kind of enlighten us about how cardiovascular health is tied into erectile dysfunction.
Yeah, I've said everything.
I have not said everything, no. I just lay foundation.
You have already Which kind of foundation? When I enter the
Am
place, I
I
see mansion.
am I
I see
building
mansion.
house?
What else are you building? You're building Lego. Are you building? Are you playing?
Am I playing it? Am I
so
playing it?
so that's. I mean, you said the important things that needs to be said. Again, there's a proverb in the Yoruba tribe that says, "Tabadake titiwano maba adake ni." And
You will kill another one. Help me.
yes, okay. That means that, what you don't say stays within you. And if it's something that is burning, it keeps burning and it never sees the light of day. Um, and so the worst disease that you can have is one that has a treatment, but because you have not said anything, you don't get treatment for it. And like you rightly said, when people have cardiovascular disease, especially when they develop atherosclerosis, you are dealing with a situation where you don't have enough blood supply. Remember, we said hypertension, diabetes, they damage not just end nerves, they also damage end organs by hurting the blood vessels. And so the blood vessels and the vascular anatomy becomes distorted over time. And so the question will now be, why am I not having an erection? And the question that we'll usually ask, and correct me if I'm wrong, maybe this has changed, is, do you wake up with an erection or you don't? Because, that could tell the doctor the reason why you might have erectile dysfunction, or part of the reasons why you might. Now, ultimately, I like to also say this, that sometimes you actually find out that someone has diabetes and hypertension just because they came in with complaining of erectile dysfunction. And that is because those diseases have started to affect the person's reproductive health. And they're that bad sometimes. On the flip side, because sexual function and sexual relations, especially if you have a significant other, is important. Loss of sexual function can increase stress and then increase your risk of having bad things and cardiovascular disease as well. So one feeds the other, but most likely than not, a lot of times, especially as we get older, you're dealing with people that have come in with, ED, erectile dysfunction, because they have some of these systemic diseases that we've already talked about. These things are preventable to a certain degree, or at least you can reduce the progression or reduce the time where it becomes a huge problem by taking care of yourself and taking care of your cardiovascular health.
Thank you so much. Thank you. They said that the English, who is speaking English? Is it me that?
Forget.
Is it me that they say is speaking English?
Oh, one bear. Forget it. I can speak.
Is it? I think it's Dr. Ogunbayo that they say speaking English. Besides saying the confusion is too much. They say, Doctor Nias, is it on us that is not a medical student? So small English is too much.
Let me break it down.
No.
Can you go to see your doctor?
God, no. I think that it is just we're just trying to talk about the interplay of blood flow. Doctor, you were explaining to us that the only reason that men have an erection is because the blood rushes from the brain into the penile area. That's why men.
That's why we don't.
That's why they can't think.
Everything is lack of. See, my guys, if you're a guy here and you have committed atrocity because of that situation, when you get to court, just say not guilty.
Not guilty. Why? Because there's no blood in the brain.
There's no blood. Is it me that caused it?
Is that God made it, eh? Are you God?
Exactly. I just, you understand?
Did you make yourself?
Exactly. What can I do? I'm a product, not the producer. just say it was a me. They say it's the two both of us that are English is okay.
ask the question that if where is the confusion? we are done with the live, but if you have any questions, we will stay. But it is just the interplay with the blood flow. Anything that decreases blood flow to the penile area will not allow the penis to become erect. So if there's blockage or in the arteries that go to the penis, like if there's, doctor was talking about atherosclerosis, which is like plaque formation, like cholesterol, calcium, all the things that can block or narrow the arteries, all of those will cause that.
And to say something real quick before I forget, for any medical condition you have, seek treatment, not a band-aid. We know about the blue pill.
Which one is the blue pill? Is that a leaf?
Oshama.
Mọ̀ọ́mọ̀ ṣá lọ lọ́rùn o, àwa láwo ṣó ṣàmọ́ o. Viagra, okay.
Cialis.
Wọ́n láti ń break it down, wọ́n láti ń sọ̀rọ̀ nísìnyí, wọ́n ní now we are talking.
Now, those things can help, but in some instances, they're putting a band-aid on the problem, especially those people that get it online. You, number one, make sure if you want it, talk to your physician about it and make sure it is, number one, safe, and number two, indicated, meaning you actually need it. Sometimes you put a band-aid on something without fixing the problem. You think the problem is fixed, but the problem is still festering under that band-aid. And you don't want to be that person. So please, number one, don't self-medicate. Don't get prescription medications online because you think this one is just for when I need something to be gingered. Please, that alone can tell if you have other problems that is causing you to have erectile dysfunction that can be fixed. So please don't take matters into your hands in any way, shape, or form. Even forget ED when you talk about ED or anything else. Another reason is you might be on a medication or medications that work in the same line as this Viagra or this other pills you buy online that may drop your blood pressure to very unsafe levels or cause other problems that you don't know. So please don't just say there's a fix for it and go find it. Find a physician and talk to them.
Thank you so much. And doctor, please, but what if I don't want to go to the doctor? If àwọn nǹkan bí alomo bí paraga díẹ̀ bí ọ̀pá ẹ̀yìn, if I'm able to lay my hands on those type of things, can I apply those type of things to the situation?
What's the FDA number?
FDA or the NAFDAC number?
What's the NAFDAC number? Have the FDA approved it? what's the NAFDAC number of that alomo bitters you want? So there are, most of our drugs actually come from herbs. The problem with using herbs is that you don't know when it is enough or when it's more than enough. And the reason why we prescribe certain milligrams or strength is because after a certain amount it becomes dangerous. So while you can get some of these things in herbs and so on and so forth, you probably want to be careful because you don't know the appropriate dose. You don't know what the what you call therapeutic index is, meaning the dose at which the thing works well. And sometimes it is such a narrow thing, and you talk about the rate or the dose at which complications start, and it might not be too far from where the dose is that actually gives you the effect you need. So you might tip yourself to the other side and start causing other problems that you didn't bargain for by using some of those things. Although Okpa is good sometimes. Call me after, I'll tell you.
You tell me, thank you. DFM. We have had a wonderful comeback tonight, and I do want you to go home to your family members and get ready for church. I've told you that the combination of Bolaho and myself is not a good combination. Please, when you go to church tomorrow, please pray for us. Not only today or tomorrow, pray for us every day. We need deliverance and anything else that you can. Thank you so much, everyone that has hung with us tonight. I know that there are several topics that we have brought up tonight. I mean, we brought up the topic of nutrition. We brought up the topic of exercise, which could actually be topics that we will have to explore on their own as part of the series for 2023 and season 4. So we'll look into that to fit into the production schedule, because we already have a schedule. My lover, I think I missed my lover in the beginning. I have lover on this forum. What is it? That's it's even a girl.
You'll be hearing from my my lawyer.
Why? I have lover all over. I only one lover though, but boyfriend is plenty. You want to sell or you want to buy? I'm even planning a trip. One of my boyfriends, he said I should come and visit my sisters in Canada. He didn't say I should come and visit him. He said I should come visit.
Can I come?
You can come. You can. I will take you. What is it? I will take you. You can come this weekend and next weekend. You can come. Toyi, I will send.
Every day.
I will send Toyi to you.
I'm coming.
Coming to America. Dear fam, thank you so much. I did say hi to Auntie Erin, to everybody else who did. Uncle Peter! Uncle Peter is here. Uncle Peter said only me. I don't know what I said that you said that. But God will help me. Uncle P said so. He said some. Thank you so much for. Hey, Onyechi.
Uncle P was supposed to be on this something.
On this forum? Why? Is he a doctor?
You don't know what P means?
What?
Uncle P has PhD in something.
He's even a doctor. So what is it?
Yeah.
So he can add to this conversation.
No.
Yes.
He add, not can.
Then Pastor Olu is here. Pastor Olu is here. Ogunagbara. Be careful about the Ogunagbara. Precious is saying, thank you, Dr. G. Hey, Motalani, thank you so much. Thank you, Mommy Shaga says, well done, Dr. GBOLAHAN. Ogunbayo, more grace, regards. My lover. Atayo says you'll be praying for both of us, of course. We need it. We need it, please.
We need it.
Yes. Hi, Shewa Kids. Thank you so much, DM fam. Like I said, we'll be back in a couple of weeks, but I'm going to try to cast at 2 p.m. CST. Of course, we'll send out a promo video then, and I'm happy to be back. Thank you. Thank you so much for every day. Please enjoy your Valentine's Day. Please enjoy it. Let me leave you a voice note that you can pray for your somebody. If you have somebody. My love, there's only you in my life. The only thing that's right. My first love. You're every breath that I take. You're every step I take. And I love to share all my love with you. No one else will do. And your eyes, they tell me how much you care. You will always be my endless love.
Wait first. You're supposed to skip one place. Say my first love. What if it's not the first love?
It's not the first. All things have become new.
Okay, it's first.
All things. Everybody lórí irọ́. Àwọn kan ní lórí irọ́. You're my lover. Lórí irọ́. You're my honey. Lórí irọ́. Lórí irọ́. Lórí irọ́. Good night, oh. Good night, oh. Daily Most of my lost one. Good night, oh.